Erectile dysfunction, often abbreviated as ED, is a prevalent condition that affects a significant number of men worldwide. Its impact extends beyond the physical realm, influencing emotional well-being, relationships, and overall quality of life. From a medical perspective, understanding erectile dysfunction requires a comprehensive look at its causes, risk factors, diagnosis, and treatment options, as well as its psychological implications. The physiological process of achieving and maintaining an erection involves a complex interplay of the nervous system, blood vessels, hormones, and psychological factors. When a man becomes sexually aroused, the brain sends signals through the nervous system, which leads to the relaxation of the smooth muscles in the penis. This relaxation allows blood vessels to dilate, increasing blood flow into the penis and resulting in an erection. For an erection to be sustained, the blood vessels must remain open and the blood must be trapped within the penis. If any part of this process is disrupted, erectile dysfunction can occur. Numerous factors can contribute to the onset of erectile dysfunction, and these can be broadly categorized into physical and psychological causes. Physical causes are often related to underlying health conditions. Cardiovascular diseases, for example, can impede blood flow to the penis. Conditions such as atherosclerosis, where the arteries become narrowed due to plaque buildup, can lead to decreased blood flow and result in ED. Diabetes is another major risk factor. It can cause nerve damage and affect blood flow, making it difficult for men to achieve an erection. Additionally, high blood pressure and high cholesterol can also contribute to erectile dysfunction by affecting vascular health. Hormonal imbalances can also lead to erectile dysfunction. Low testosterone levels, for instance, can affect libido and the ability to achieve an erection. Endocrine disorders, such as thyroid problems or pituitary gland issues, can similarly disrupt hormone levels and contribute to sexual dysfunction. Furthermore, certain medications, particularly those used to treat high blood pressure, depression, and anxiety, may have side effects that include erectile dysfunction. In addition to these physical factors, psychological elements play a crucial role in erectile function. Anxiety, stress, and depression can significantly impact sexual performance. The high-pressure environment of modern life can lead to feelings of inadequacy and performance anxiety, which can create a cycle where worries about sexual performance lead to further difficulties maintaining an erection. Relationship issues can also contribute to psychological erectile dysfunction. Lack of communication, unresolved conflicts, or feelings of disconnect with a partner can affect sexual intimacy and performance. Diagnosing erectile dysfunction typically involves a thorough medical history and physical examination. Physicians will often ask about the duration and severity of the condition, as well as any underlying health issues. Blood tests may be conducted to evaluate hormone levels, blood sugar, and cholesterol levels, while other tests may be performed to assess blood flow and nerve function in the penis. Once diagnosed, treatment options for erectile dysfunction can vary based on the underlying cause. For many men, oral medications known as phosphodiesterase type 5 inhibitors, such as sildenafil or tadalafil, may be prescribed. These medications work by enhancing the effects of nitric oxide, a chemical that relaxes blood vessels and increases blood flow to the penis. While these medications can be effective, they are not suitable for everyone and may have side effects. For instance, men taking nitrates for heart conditions should avoid these medications due to potential serious interactions. In cases where oral medications are ineffective or contraindicated, alternative treatments are available. Vacuum erection devices, which create a vacuum around the penis to draw blood into it, can be an option. Penile injections, where medication is directly injected into the penis to induce an erection, are another avenue. Additionally, there are penile implants, which are surgically inserted devices that can provide a permanent solution for erectile dysfunction. These implants can be inflated to create an erection and deflated when not in use. Lifestyle modifications can also play a pivotal role in managing erectile dysfunction. Encouraging patients to adopt a healthier lifestyle, including regular exercise, a balanced diet, and maintaining a healthy weight, can improve overall health and reduce the severity of erectile dysfunction. Quitting smoking and limiting alcohol intake can also have a positive impact on erectile function, as both smoking and excessive alcohol consumption are known risk factors for ED. Furthermore, addressing psychological contributors to erectile dysfunction is equally important. Counseling or therapy may be beneficial for men experiencing anxiety, depression, or relationship issues. Cognitive behavioral therapy can help individuals address negative thought patterns and develop healthier coping strategies. In some instances, couples therapy may help improve communication and intimacy within a relationship, thereby alleviating some of the psychological barriers to achieving and maintaining an erection. Education plays a vital role in managing erectile dysfunction. Many men may feel embarrassed or reluctant to discuss their condition, leading to a lack of understanding and potential worsening of symptoms. Healthcare providers should foster an open, non-judgmental environment where patients feel comfortable discussing their concerns. Providing clear information about the nature of erectile dysfunction, its causes, and available treatment options can empower men to seek help and make informed decisions about their health. In recent years, there has been a growing interest in alternative treatments for erectile dysfunction. Some men may seek herbal supplements, acupuncture, or other non-traditional therapies. While some of these approaches may have anecdotal support, it is crucial for patients to discuss these options with their healthcare providers to ensure safety and efficacy. Not all alternative treatments are backed by scientific evidence, and some may interact negatively with prescribed medications. Erectile dysfunction is a multifaceted issue that requires a holistic approach to treatment. While medical interventions can address the physical aspects of the condition, attention must also be given to psychological and relational factors. Collaborating with healthcare professionals, including urologists, endocrinologists, and mental health specialists, can provide a comprehensive treatment plan tailored to the individual patient's needs. As societal attitudes toward men's health continue to evolve, it is essential to reduce the stigma surrounding erectile dysfunction. Open discussions about sexual health, coupled with increased awareness and education, can help men seek the help they need without feelings of embarrassment or shame. Healthcare providers should advocate for men's health initiatives that promote awareness of erectile dysfunction as a common medical condition rather than a personal failing. In conclusion, erectile dysfunction is a complex issue with a multitude of contributing factors. From a medical perspective, understanding its causes, risk factors, and treatment options is crucial for effectively managing the condition. By addressing both the physical and psychological aspects of erectile dysfunction, healthcare providers can offer comprehensive care that improves the quality of life for affected individuals. Encouraging open dialogue about sexual health and fostering a supportive environment can empower men to seek help and take proactive steps toward better sexual health. Ultimately, recognizing erectile dysfunction as a legitimate medical condition, rather than a taboo topic, is vital for advancing men's health and well-being. Erectile dysfunction is a condition that affects countless men worldwide, yet it remains shrouded in social stigma and misunderstanding. As we delve into the various social perspectives surrounding erectile dysfunction, it's essential to recognize that this condition is not merely a medical issue. It is deeply intertwined with cultural norms, societal expectations, and personal experiences. Many men experience erectile dysfunction at some point in their lives, but the way society perceives this condition shapes the experiences of those affected by it. From a medical standpoint, erectile dysfunction is defined as the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. However, the implications of this condition extend far beyond the physical realities. The social narratives surrounding erectile dysfunction often reflect broader themes of masculinity, performance, and self-worth. In many cultures, a man's ability to perform sexually is closely tied to his identity and societal status. This connection creates a significant pressure for men to maintain their sexual health, leading to feelings of inadequacy or shame when faced with erectile dysfunction. The societal expectations regarding masculinity play a crucial role in shaping the discourse around erectile dysfunction. Traditional views often associate masculinity with sexual prowess and virility. Men are frequently socialized to believe that being able to engage in sexual activity is a fundamental aspect of their masculinity. As a result, erectile dysfunction can be perceived as a direct challenge to one's manhood. This perception can lead to a reluctance to seek help or discuss the condition openly, as doing so may feel like admitting a failure to conform to societal norms. The fear of judgment and stigma can further exacerbate feelings of isolation for those experiencing erectile dysfunction. Moreover, the portrayal of masculinity in media further complicates this issue. Movies, television shows, and advertisements often depict men as confident, sexually assertive, and perpetually ready for intimacy. These representations create unrealistic standards that many men feel pressured to meet. When faced with erectile dysfunction, the contrast between these societal ideals and personal experiences can lead to significant emotional distress. Men might internalize the belief that they are somehow less worthy or desirable because they cannot live up to these expectations. This internal conflict can lead to anxiety, depression, and a cycle of avoidance that reinforces the stigma surrounding erectile dysfunction. In addition to the societal pressures of masculinity, cultural perspectives on aging also contribute to the conversation about erectile dysfunction. In many cultures, aging is associated with a decline in physical abilities, including sexual performance. This perception can create a sense of inevitability around erectile dysfunction as men age, leading some to view it as a natural part of life. However, while aging may contribute to the prevalence of erectile dysfunction, it is essential to recognize that it is not an unavoidable fate. The cultural narrative surrounding aging can either empower men to seek solutions or dissuade them from addressing their concerns due to a belief that it is simply a part of getting older. Religious and cultural attitudes also play a significant role in shaping how erectile dysfunction is viewed and discussed. In some cultures, discussions around sexual health are taboo, and seeking help for erectile dysfunction may be discouraged. This lack of open dialogue can create an environment where men feel ashamed or embarrassed to admit they are experiencing difficulties. Consequently, many suffer in silence, fearing judgment from peers or family members. This cultural silence can perpetuate the stigma associated with erectile dysfunction and create barriers to accessing care and support. As we consider the social perspectives surrounding erectile dysfunction, it is important to acknowledge the impact of relationships on how this condition is experienced. The dynamics between partners can significantly influence how erectile dysfunction is perceived and managed. Open and honest communication between partners is crucial in navigating the emotional landscape that accompanies erectile dysfunction. However, societal norms often discourage men from discussing their feelings or vulnerabilities, making it challenging to foster an environment of support and understanding. This lack of communication can lead to misunderstandings, resentment, and a breakdown in intimacy, further complicating the situation. In recent years, there has been a growing movement to destigmatize discussions surrounding erectile dysfunction and promote a more open dialogue about sexual health. Advocacy groups, healthcare professionals, and individuals have begun to challenge the traditional narratives surrounding masculinity and sexuality. By encouraging men to seek help and share their experiences, society can begin to dismantle the stigma associated with erectile dysfunction. This shift has the potential to foster a culture where men feel empowered to address their health concerns without fear of judgment. Education plays a critical role in reshaping the conversation around erectile dysfunction. Providing accurate information about the condition, its causes, and potential treatments can help demystify the issue and encourage men to seek help. By normalizing conversations about sexual health, society can create an environment where men feel comfortable discussing their experiences and accessing the care they need. This educational approach can also challenge harmful stereotypes and promote a more nuanced understanding of masculinity that includes vulnerability and emotional expression. It is also essential to recognize the role of healthcare providers in shaping the social perspectives surrounding erectile dysfunction. Medical professionals have the responsibility to create safe and supportive spaces for men to discuss their sexual health concerns. By approaching the topic with sensitivity and understanding, healthcare providers can help reduce the stigma associated with erectile dysfunction and encourage patients to seek the help they need. Building trust and rapport between healthcare providers and patients is crucial in addressing the emotional and psychological aspects of erectile dysfunction. As society continues to evolve, it is important to challenge the outdated beliefs and stereotypes surrounding erectile dysfunction. This condition should not be a source of shame or embarrassment but rather an opportunity for growth, understanding, and connection. By fostering open dialogue, promoting education, and encouraging empathy, we can reshape the narrative surrounding erectile dysfunction and create a more supportive environment for those affected by it. In conclusion, erectile dysfunction is a multifaceted issue that is deeply influenced by social perspectives and cultural norms. The stigma surrounding this condition can create significant emotional distress for those affected, often preventing them from seeking help or discussing their experiences openly. By challenging traditional narratives of masculinity, promoting education, and fostering open communication, society can work towards dismantling the stigma associated with erectile dysfunction. In doing so, we can create a culture that values vulnerability, empathy, and understanding, ultimately empowering men to take charge of their sexual health without fear of judgment. As we continue to advocate for open conversations about sexual health, we pave the way for a future where erectile dysfunction is no longer shrouded in silence, but rather addressed with compassion and support.